Hello and welcome back to the show. Today I am thrilled to have a very special guest. Dr. John Neustadt is with me today, and he's going to talk to you all about your bones. And as somebody who's taken care of so many women with hip fractures and spine fractures, I think this topic is something that we all need to know about. Mainly women, but definitely men as well, because anybody can develop these fractures. And the bone health is tremendous. And I remember way back when in medical school and in residency, at that time, that hip fracture stood between you and the rest of your life, because a lot of the time, people who had a hip fracture spent the rest of their lives in a nursing home. And so I'm so excited. And let me tell you a little bit about him. There's so much to tell. So Dr. Neustadt is the founder and president of Nutritional Biochemistry, Inc. And he has published more than 100 medical articles, written 4 health and wellness books, and he is a #1 Amazon best-selling author in the field of osteoporosis. His book, Fracture Proof Your Bones, is a comprehensive guide to osteoporosis, and I'm going to let him tell you more about himself. So, first of all, Dr. Neustadt, welcome to the show.
Thank you. It's a pleasure to be here.
So, I am excited and I'm all ears. So, tell us more about your journey and what everybody needs to know to optimize their bone health.
Well, you have firsthand experience of how devastating a fracture is, especially a hip fracture. If you're an osteoporosis, if you have osteoporosis and you're a woman, there's up to a 36% chance that you're going to die in the first year after a hip
Wow.
fracture. And that's if you don't have any other conditions, like if you don't have breast cancer or any on certain medications that can increase the risk of fractures and falling. But I didn't know all of this 20 years ago. What I knew 20 years ago when I was just starting out, as a baby doc, starting out in clinical practice, I think we all do this. We do what we're trained to do. I was working
Exactly.
in integrative medicine, using nutrition, dietary supplements, exercise, lifestyle with patients. And their bone density was going up. My mother-in-law at the time had osteoporosis, and she was on Fosamax. Physician put her on Fosamax, which is still the standard of care, first line therapy for most patients. Her bone density was going up. I was working with her a little bit, giving her some recommendations, but she was not a patient of mine. Anybody who knows, treating family is a really not a smart thing to be doing, especially in a primary care setting. So I was just helping her with some recommendations for some supplements and exercise and diet. And then she tripped on a throw rug in her house and fractured her head. And her bone density had been going up. So I was thought she was protected, and her physician thought she was protected, and so did she. And then I dove into the research to try and learn more, and I was shocked by what I learned. A bone density test only predicts 44% of women with osteoporosis who will fracture, and only 21% of men. And every
Mhm.
medical organization that looked at the data has correctly concluded that fracture risk depends on factors largely other than bone density. But even today, 20 years later, that number on the test is almost exclusively what doctors focus on. And so it's leaving patients woefully unprotected. And there's a lot of misunderstanding about then what they can do that is part of this overall puzzle and integrative approach to maximize their ability to improve their bone health. Also, yes, improve that test number. We want to see that going up, but most importantly, reduce their risk for breaking a bone. That is, give them the ability to maintain their bone strength, hopefully for as long as they live, so they don't suffer the dangerous and oftentimes debilitating consequences of a hip fracture.
Mhm. Yes. Aside from the most unpleasant prognosis, just the pain. Um, I remember going into many hospital rooms, and the patients, more often than not, women, the legs were distorted and they were just in excruciating pain. And when you're older, strong pain medications You really want to avoid them for multiple reasons. And so
Yeah.
anything that we can do to decrease our risk is so vital. So, what would be the first thing you would tell the listeners about their steps that they can take to optimize their bone health?
When I talk to patients, most of the time they're very anxious. They've recently gotten the diagnosis and they're scared. And rightfully so. It's a scary condition with a lot of stories like ones that you know of and that I know of. Many people also have a relative, a grandparent, or a parent who fractured, and that was the beginning of the end, and or the chronic pain that can occur after that happens. And they don't want that. And so it's scary. But what I do is I have them take a few deep breaths and calm down. And I tell them what I just said to you about the value of the bone density test. It's important to get, but it's only one piece of a much larger puzzle. And that it's important, this diagnosis and dealing with it and confronting it and being proactive. But it's not an emergency. There's time to educate ourselves and
Mhm.
create a holistic bone health program that makes sense for them. And there are two sides of this bone health equation that I focus on. One is, are there things in people's lives that are destroying the bone? Because essentially, bone loss is a condition of imbalance where the destructive forces are winning. In healthy bone, there's a concept called bone remodeling, where there are the bone building osteoblast cells, and then the osteoclasts are another type of cell that break bone down. And so old, worn out bone is constantly being broken down, and new bone is constantly being created. And when that's in balance, your bone density doesn't go up or down. It's just stays there because you're not having any faster bone loss than bone creation.
Mhm.
In terms of when you start seeing that go down, there's something that's contributing to the bone density loss. So can we identify what that is and to weakening bones? And there are a couple of very common categories of issues that are important to look at. One is the medications that people are taking. That is a commonly overlooked area where bone is being destroyed, and the doctors who are prescribing those medications are unaware of it. It's just not on their radar. They haven't learned about it. And so patients aren't counseled about this risk. So I'm a big fan of doing a medication review with your physician, with your healthcare provider, but also your local pharmacist. They have access to all the greatest and latest databases that can tell them very quickly if
Mhm.
those medications are associated with causing bone loss. And there are some that many doctors know about, like prednisone, the glucocorticoids, powerful anti-inflammatories. But 2% of the population is on that category of medication. And what we know is that people run it long term, that it has a 50% chance of breaking a bone. And the bone destruction that occurs is something that doesn't even show up right away on a bone density test. So people's risk for fractures can actually go up before it shows up on a bone density test. But many people aren't really counseled about that, which is a known medication that's widely known to destroy bones. And then there are other medications that doctors just really, it's not on their radar at all, like the antidepressants. Even before COVID, about 25% of women over the age of 50 were on an antidepressant. And the most commonly prescribed category of antidepressants are selective serotonin reuptake inhibitors. They artificially increase serotonin. People know, Prozac, that's a commonly known brand of that. Well, there are serotonin receptors on bone, and they stimulate osteoclasts, those bone breakdown cells, osteoclasts. And now we know from studies that for every 19 women taking an SSRI for more than 1 year, 1 to 5 years was the study, that we would expect one of them to break a bone. And
Wow, that's
eh,
huge.
the other category of drugs that also increase serotonin, the serotonin and norepinephrine reuptake inhibitors, or SNRI, that's commonly not understood in the U.S. by doctors who are aware of this to cause bone damage and increase fractures, but a large Canadian study has shown that even that category of medications damage bone as well. And proton pump inhibitors, acid blockers, specifically the proton pump inhibitors, have been shown to damage bone and increase hip fracture risk. And many people are taking them for years and years at a time and aren't being screened for with a bone density test. So it's really important, I think, to have a medication review to understand if that's a risk. And then hopefully, if you are on that medication and you need to still be on something beyond a medication, that you can either switch to a safer one or decrease the dose, because pretty consistently in the research, what we see is the higher the dose and the longer
Mhm.
someone takes it, the greater the risk. So even if you can decrease that dose, you may get some benefit from that in terms of reducing your risk of damaging bones and increasing your fracture risk. And in terms of other medications, there's a long list. I mean, I haven't even barely scratched the surface of the number of medications that are now understood and documented to damage bones. And in my book, the second edition recently came out, Fracture Proof Your Bones, expanded and updated edition. There's an expanded chapter on medications that damage bone, and so people can use that to have conversations with their doctors. And in fact, most doctors just aren't aware of it. So people really need to educate themselves and be proactive and initiate these conversations.
I couldn't agree more. I mean, when you talk about proton pump inhibitors and all of these other drugs, in the midst of a busy day, doctors do not have time to go and look at every potential side effect. I haven't seen a PDR, physician's desk reference, in ages, but I remember they used to be like this thick.
Yep.
Every drug has the potential to have a tremendous number of side effects. And so also during the course of your visit, your doctor may not have the time to go through all of that either. And I love that you said people need to educate themselves. I believe there's a site called drugs.com. And I would assume that that site and others will have that information so people can pull out the medication list like now and go to drugs.com or Google side effects of medications and see which drugs that they're currently taking that have the potential to put that balance of the osteoclast, the ones that break down, versus the osteoblasts, the ones that build up. If that balance is off, and you can see that online, you make a list of those drugs and contact your doctor. You may or may not need them. I know people are on proton pump inhibitors far longer than they need to be in general. And between the bones and the C. diff and all these other things, it's common that people are left on drugs too long. And so I love your idea that people look into it themselves, because the doctors really just don't always have the time. The pharmacists may be very busy as well. So what else would you recommend on a day-to-day basis? What would you tell a woman over 40 to do and
So,
incorporate to
yeah,
strengthen her bones?
I think the most important things are the foundations of long-term health, which not only applies to bone, but applies to every other risk for long-term challenges like Alzheimer's disease and cancer risk and dementia and diabetes and obesity and on and on and on. And that is diet, lifestyle, and exercise. Those are the foundations of long-term health. And the research is very clear with bone health that it's no different. What we want to focus on in terms of, first, if I can address that category of things that are destroying bones, there are certain foods or types of foods that people should try and minimize as much as they can. And those are the ultra processed foods, packaged foods. About 60% of packaged foods in the US, I'm sorry, 60% of calories in the American diet now are from ultra processed foods. And about 70% of packaged foods on store shelves are ultra processed foods. And those are foods that are sold for convenience. You can microwavable, they don't have an expiration date, they're highly processed. And what the research shows across the board is that if you get too much of them, that it increases your risk for cancer, diabetes, Parkinson's disease, osteoporosis, all-cause mortality, diabetes, I said that already, obesity, on and on and on, bone loss. And there's a wide range of results out there in the study, and they looked at different ways of evaluating the risk. But it appears that, about 10% of total calories from ultra processed foods seem to be the cutoff. And above that is when the research starts showing these problems starting to crop up. So if you remember, as I said, 60% of calories in the American diet are ultra processed foods, and people really should be consuming, at least based on what the research shows now, less than 10%. I'm a realist. I think it's going to be hard to completely eliminate this, but I think becoming conscious of what people are eating is a very important first step, and beginning then to transition into more of a Mediterranean dietary pattern. That's a plant forward, whole foods diet, which has been studied for decades and shown to have it's associated with a 20% reduction in osteoporosis and hip fracture risk, and also reductions in all those other chronic conditions that I've mentioned. And the greater somebody adheres to that diet, the greater the benefits. And so that's essentially vegetables, fruit, whole grains, lean proteins like chicken and fish. Yes, red meat, but in fewer, not consumed as much as in the United States. And one of the things though that I do recommend, and in my book and on my website, I have instructions on how people can transition into eating this way for the rest of their life. I'm not a big fan of just focusing on what not to do. I want to help people transition into developing healthy eating habits that can carry them for the rest of their life. And so I have people focus on just fiber and protein. So that's the total fiber from plants, from whole foods. That's going to give you the vitamins, the minerals, the other plant nutrients that our biochemistry in our body needs to thrive, as well as healthy fiber, which is good for the gut microbiome and modulating inflammation and overall wellness. And the protein is important because there are 180 to 200 proteins in bone in addition to collagen. It's highly protein dependent. And the research shows as we get older, the amount of protein we need to sustain healthy bone density and muscle mass is greater than what's recommended by the USRDA. So I recommend in my book and on my website that people get a minimum, if they have their body weight in pounds, multiply that by 0.6 grams of protein per pound of body weight. That's the minimum amount of protein I recommend they get. And then they transition into sort of increasing that and increasing the amount of fiber over time, whatever's comfortable for them, to develop those healthy eating habits. And if they need a dietary supplement to supplement the amount of protein, that's great. But it should primarily and ideally come from food. Movement, another crucial component, exercise. You don't want to go to a gym, you don't want to lift weights, no problem. You don't have to. I know that is sometimes really promoted as what people have to do. And weight bearing exercise is great, but I'm also a realist. Not everybody wants to go to a gym. Maybe people are so deconditioned, they haven't exercised in many years, and going to a gym, maybe they're concerned about getting injured or it's just not interesting to them. I like to meet people where they're at because there are so many options, even just walking. Walking 7,000 to 7,500 steps per day is associated with a 50 to 70% reduction in all-cause mortality. So get your steps in. Garden, be active, dance, whatever it is that lights you up, that's great. Take a class, but do it safely. So exercise, if you are going to go into a gym or you're going to take a class and you have osteoporosis or you are of an advanced stage, make sure that it's safe for you, that it's modified, either the intensity or the moves, to ensure that you're not actually going to break a bone, because some exercises, when you have osteoporosis and your bones have weakened, can actually increase your risk for fractures. So be aware of that, educate yourself. There's a whole chapter in my book on exercise. There are also wonderful other resources, books out there on exercising safely with osteoporosis and bone loss. One of the other areas that's oftentimes missed, that's not talked about, is ensuring you get enough sleep. A lot of people, especially as we age, aren't getting enough sleep, or their quality of their sleep isn't good. And the research is clear. People who sleep on average less than 6 hours a night have a faster rate of bone loss. And a study came out of the United Kingdom that evaluated medical records of thousands and thousands of patients and concluded that lack of sleep or poor sleep was responsible or associated with 17% of all the fractures. So it's not just weakening bones, it's also decreased balance and decreased reaction time. And that can occur when you are sleep deprived. So
Mhm.
ensuring that. In terms of something else that I think is really important is community and connection, modulating stress. We know for a fact that elevated cortisol damages bone and increases fracture risk. And in fact, a study was done that tested cortisol in patients and found that even those in the normal range, they were towards the high end of normal, they were still normal, had a faster rate of bone loss than people whose cortisol was lower. Cortisol is the stress hormone, if your listeners aren't aware of that, and people, unfortunately, a lot of people are under chronic stress. So connecting with community, having that support, doing things you love, figuring out ways to de-stress and relax, all are very important, not just when it comes to overall health that people are aware of, but yes, in terms of bone health. In fact, there was a study that was done that looked at community connections and community networks, having friends. And what they found is that those people who had strong friends, and it didn't have to be many, I think it maxed out the benefits at 3 close friends that you do some stuff with, that you talk to. If they did fracture, they had a faster recovery time. And so
Mm.
it's also about setting the stage for if, God forbid, something does happen, that your body has what it's need to heal and do what it wants to do as efficiently and effectively as possible.
That makes me think about, the pillars of lifestyle medicine. You basically went over most of them. And so you talked about the love connections. And I was very happy, or I was very intrigued when I learned how these connections make you release oxytocin. And
Mhm.
oxytocin counteracts cortisol. And I don't know if that's the mechanism, but it's wonderful that love connections are also good for your bones. I want to talk
I
about
think it
your
is.
book.
I think it is an important connection because what was discovered is that osteoblasts actually produce their own oxytocin, and there are
Really?
oxytocin receptors on cells in bone, and it promotes bone health and it improves bone density. And there have been animal studies that have been done that show this. And there are also studies in postmenopausal women with osteoporosis that showed that those who had it had lower oxytocin than those who did not have bone loss.
Wow. Another reason to love.
That's right.
Let's talk about your books. So let's start with the first book you wrote, synopsis, and then why did you write the second book?
Mhm.
And I want to delve into the books because you've given some tremendous information that can literally be life enhancing and even life prolonging, considering the downhill course after a fracture. So let's delve into the books. What are their names? How can people get them? And give me a synopsis of both of them.
So the books that I wrote for bone health, the first one is Fracture Proof Your Bones. That was the first edition. The second one has the same primary title, and it's
Mhm,
Fracture Proof Your Bones Expanded and Updated Edition. The first one came out in 2022. The
mhm.
second edition we just announced it 2 weeks ago, so recently, 2026. And I wrote the first one because I kept getting the same questions over and over, not just from patients, but from clinicians as well, about what is my approach? What can they do from a holistic perspective? Because as you alluded to or said earlier, this condition, it's really challenging to to help people in short office visits. But even if office visits were longer, what the research shows, there was a study that came out of out of Europe that showed that doctors there, physicians, didn't feel comfortable treating osteoporosis because they weren't prepared. They weren't educated. They weren't sure how to interpret the bone density test, what were the best medications to recommend. They weren't trained on diet or lifestyle to counsel patients. And so they were just confused and uncomfortable with those conversations. And a study was a couple countries in Europe, same conclusions, and I think it's the same in the United States. And so writing this book for me was a labor of love to help people understand what they can do. It walks people through chapter by chapter how to create holistic bone health programs for themselves, and gives them questions to ask their healthcare providers to ensure that they're getting the best possible recommendations for their medical history and their current issue or challenge they're dealing with and their goals. And in doing so, with the second edition, it became very clear to me after the first one that I would go and lecture at medical conferences, or I would talk to patient groups, and I was being asked questions, great questions that I didn't answer in the first book. And there's additional research that had come out since then that I learned about. And I expanded the book beyond just the primary demographic, which is postmenopausal osteoporosis. And so now there's secondary bone loss from conditions like autoimmune diseases, from cancer, from male osteoporosis. And that gives people the information and the perspective, again, to educate themselves, to have these conversations with their doctors, and to create programs that make sense for them. And look, an osteoporosis medication may be part of that, but it's about being able to ask the right questions to evaluate if a medication is appropriate, if the potential benefits do outweigh the potential risks. And I've been told multiple times by doctors that, at least with my first edition, and I hope it's going to be the same with the second edition, that patients are actually bringing the book into their appointments because there are take action sections at the end of chapters, and they can write notes and have their questions ready for them. And some doctors even told me that they've taken the book and they've prescribed the book, and they've said, this is what we're going to do, read this, and this is what we're going to implement. And then they walk them through and are able to monitor, track, and adjust and customize the program as they go through it.
That sounds incredible. I wish I had that when I was in primary care. I want to ask you another question. Tell us about nutritional biochemistry.
Well, that's my company I started in 2006. I was doing a lot of nutrition work with my patients and got frustrated because I could not find the doses of nutrients shown in clinical trials to work that I needed. And so I created a company to provide those solutions. And 20 years later, still going strong, still with that same basic philosophy of providing clinical trial based formulations that give repeatable, predictable results, many times can be shown on testing, because patients deserve it, and the consumers deserve it, and doctors who are using nutrients and nutrition in practice with their patients deserve it. Now, to be clear, these are dietary supplements. They are not approved by the FDA to diagnose, treat, or prevent any disease. But what the research shows is very clear that when you use the right nutrients in the right combination and the right doses, it can powerfully promote healthy physiology, healthy biochemistry, and overall health and wellness. And we see that with the bone health research as well. And so I do have formulations for bone health that can promote healthy bone density and maintain strong bones. In fact, we guarantee it. And that is sort of the underlying reason of why I created that company, again, to create a solution for a problem that I was seeing people were struggling and suffering with.
So a lot of people are going to want to know where they can get your books and how they can learn more about your company.
Probably the best place is my website, nbihealth.com, nbihealth.com. That has all the links there, has lots of articles on there, more information. The book is also available on Amazon, but nbihealth.com is my main website.
So N for nutritional, B for biochemistry, and I for ink, nbihealth.com.
Correct.
And they can purchase your book at Amazon. Can I get the name of the book again? The
Yes,
names?
Fracture Proof Your Bones, expanded and updated edition. And they can also purchase that on my website.
Sounds great. Is there anything you want to leave the listeners with today?
Just that, don't be discouraged. It's challenging out there. Anybody struggling with bone health challenges, I've heard the stories, and it's not a great situation when it comes to conversations people are having with they're providers mostly. Most of the time I hear stories of people feeling scared and overwhelmed and feeling pressured to make quick decisions and not getting the information they need. So I hope that what I can provide for people are resources and solutions to help them not just have hope, but be able to implement programs and take the steps that gives real results that does show up on testing as well.
I have to admit that based on my conversation with you, there are things that I'm going to be doing differently as well. And I love all the information that you're giving, and the value is tremendous. And I cannot stress enough to people, if at all possible, you want to prevent hip fractures, you want to prevent spine fractures, you want to prevent anything that's going to not only limit your mobility, but also potentially impact your life expectancy. The quality of your life is huge. And the information that he shared today, it can completely transform your health trajectory. And so I encourage everybody listening to go to the website, learn more about all he has to offer. And I want to thank you again, Dr. Neustadt, for being on the show. And I
Thank
hope
you
you have
so
a
much.
blessed day.
Thank you for the opportunity.
You're welcome.